Okay, excellent. That's my disclosure on the lower right-hand side. I work for Agfa Healthcare. Thank you for the invitation, giving a industry perspective. My contact information is on the lower left. You might notice I don't see you don't see Facebook up there. I learned a long time ago when your son doesn't want to become your friend on Facebook, maybe you should just give up, and I have. So that's my life lesson. Okay, so I'm going to take one step back and try to put some of the things we learned from this morning together with this afternoon. Sort of like how do we actually get here? Well, when the industry takes a look at what products we want to bring to market, of course, we're guided by what the customers that we talk to are looking for, but also it's the regulatory and governmental advice, if you will. And FDA being a large part of it, but also there's a lot of legislation that we try to follow. And obviously, very much in the news every single day lately is, of course, some of the major legislation that has really impacted healthcare IT. And of course, with the HITECH Act, we've got meaningful use. And now we're starting to see images need to be part of the EMR. Well, it was actually back in 1997 that the IOM said that the EMR is actually going to contain text, images, motion, videos, and like. So now we're starting to see the technology actually come all together to make these products commercially available and really routine in daily care. Of course, mobile devices are in the news every single day, not just for our own personal use, and I'm sure everyone in this room has some type of device on them, if not more than one, but we're also seeing mobile EMR on the rise. And now that we need to put images inside of the EMR, of course, we're being questioned about how images will become part of mobile devices. And you could just see some of the different headlines that have been out there over the past few, really months. It's in the news every single day. The second major legislation, of course, that was done was the Affordable Care Act, and essentially that primary output of that, there's many, but the one that seems to impact us in healthcare IT is the introduction of the ACO, or Accountable Care Organization. So the Accountable Care Organizations are fundamentally an aggregation of the data of a patient population over a certain specific geography. Now, in order to do that, of course, all of us in this room, we understand that images are really part of that data aggregation. So we need to get images from one place to another place, but not only that, we need to make them available to the clinicians no matter where they are over this wide geographic area. And that certainly has a large impact on all of us. So there's been a lot of different articles in many different journals about how radiology will play a role in that. One specific article in the AJR talked about some of the different ways that radiologists now have opportunities to play a larger role in ACOs. And if we stop a minute and start to think about it, then mobile devices, tablets, and even kiosks really become part of that. As an example, one of the recommendations to improve the service, which is a big part of the ACOs, is to have web-based scheduling. Another one is to have better consultation with the patient. We're seeing the advent of patient portal and other technologies like that. And patients, of course, want to see images on tablets and phones and the like. So a new level of service is really going to be required from radiologists, and henceforth, a new level of technology is going to will be required. And of course, we all know that that level of technology does exist today. HTML5, JavaScript, and other similar technologies are really transforming IT in general. Of course, that impacts healthcare IT. Now, many vendors are offering what's known as a zero download viewer, which is really facilitating a very easy way to get images on mobile devices. And that's really what has opened up images in the EMR or just image review for either the clinician or for the radiologist. Here we see the culmination of that different technologies, and this is the vision of the IOM. We see here, one more, sorry. We see here the EMR, and no longer are we talking about a pop-up of a third-party application. We're really seeing the images embedded inside of an iframe in that EMR. So obviously images are becoming more and more part of that EMR. So if we take a look now where we are today, obviously a very important topic. The FDA guidance is something that we're certainly looking forward to, and we talked about what I call essentially the good old days, okay? We knew where the radiologists were sitting. They were sitting there right in front of that PC. We spec'd out that PC for them. We spec'd out the video card. We spec'd out the video board that has to be used. We tested it, and we sent out recommendations, and everything was great. Life was simple. Now, we talked about bring your own device. Well, I try to think of a good analogy. Well, maybe the best analogy is the Wild Wild West, because there's no way that we can test every single model of every single type of device that's going to be out there. So fundamentally, and this is very important, I think, maybe it seems fundamental what's fundamental to me, but we are looking for that guidance. We need the ACR to help us in making safe and effective products, and we need to make sure the FDA is guiding us as well. So we welcome that. So the FDA did put out a lot of guidance on mobile devices. I'm not going to review every single detail. This is not meant to be a comprehensive list. But we could pretty much assume that if we can add a zero download viewer to a PAC system, it's a medical device. That's pretty simple. Really no questions there for us or other vendors like us. We spoke also about adding an attachment to a medical device. If I take a device and make it into an electronic stethoscope, if you will, then most likely that's going to be a medical device, and we could appreciate that, and most people would appreciate that. But it does start to get a little bit confusion. And what I would say is, what about if a mobile device now starts to use a third-party software application that was never made for anything medical? Where is that really in this whole chain of imaging? One use case example is just the use of QR codes, okay? Hospitals are using, was barcodes, now they're mostly QR codes, and essentially they're using that for patient identification. Well, it doesn't take a whole lot of technology to develop an API so that when someone takes a mobile device, either a phone or an iPad, walks up to the patient and then have their images appear. So that software that not generated the QR but read the QR, that's part of that chain now that started off from someone hitting a button on their phone to getting an image on the device. What regulations and what kind of guidance for that third-party application are we looking for? Those are the questions that we ask ourselves every day. And I think what's very important is guidance, of course, is what is not really considered a mobile device, okay? And here's, again, a somewhat of a list, not meant to be the complete list, but textbooks, general wellness apps when I go to the gym and say I ran only 1 mile today instead of 2, 3, 4, 5. Well, okay, I didn't do a good job today, but essentially that's not a medical device. Certainly, office operations are not medical devices, but now if you have a RIS PAC system with a single database with embedded scheduling, well, that's an appointment system. Is that a medical device? How do we treat those? These are the questions that we ask ourselves every day. Other devices like the magnifying glass that are just used for general aids are not. But now when we start talking about EMRs, well, surprisingly, they're not a medical device, okay? But if images are in them, well, maybe part of my screen is a medical device and part of my screen is not a medical device anymore. We're really into a whole new world that we never thought of many years ago. So some of the other challenges, I think some of this was covered in some way, shape, or form, but if you start to think about the combinations and permutations that medical software manufacturers need to start thinking about, this is what you come up with. There's different OSs, and I left off BlackBerry, unintentional, but it's missing there. Maybe that's a sign, I don't know. But there's a lot of different devices. Do we have to release for each and every device or not? Those are things that we obviously are looking for FDA guidance. There's different browser types. And not only are there different manufacturers of browsers, there's different versions of browsers. And to make our life even more complex, software providers such as Google, who make Chrome, they update that software every 6 weeks. When you log on to Chrome, you get that update whether you want it or not. There's no way that AGFA or any other company can know every single 6 weeks that Chrome made an update and it broke the image or did something to that display. So we've really entered a very, very complex world now. For every device, there's hundreds. You go into any Verizon store, you see the magnitude of devices, and every 6 weeks, I think it's 6 weeks, it could be a little bit longer, they're changing those devices. We'll never test all of those. We don't want to be a company that has, let's say, 10 testers for every developer. We want to have 10 developers for every tester, and we have to watch how we manage this situation. And of course, the manufacturers themselves, even though iPad 3 is called iPad 3, well, they're making changes to their devices all the time. We don't know what chipsets are built in there. We don't know that they change manufacturers necessarily for that screen. So when the FDA does a test, of course, we applaud that and we understand that. But that's from one manufacturing lot. How do you know the next manufacturing lot was significantly different? Companies like Apple aren't medical device manufacturers. They're not testing to the extent that potentially a Barco or someone else who's making a medical grade device is doing. Again, these companies are making changes in the manufacturing process. They're not really familiar. So if a company wants to take a transducer and put it onto a BlackBerry device, an example, and make it a medical device and sell that as an integrated system, BlackBerry isn't really aware of medical device rules. They may not even be able to spell FDA. So those are concerns that companies really need to take a look at. Now, we could spend probably a whole day just on security, and I would venture, I would actually be willing to bet that actually mobile devices are actually much more secure than a PC that's sitting in an office. Every time we read in the paper about security or data breaches at hospitals, it's usually someone had a laptop with some data on it. Well, mobile devices, if designed properly, and we need to think about these kinds of things, actually are more secure. We can make it so that the data is wiped out as soon as the radiologist or the clinician walks away. These things need to be built in. And as we move to the cloud, and everyone's moving to the cloud in one shape or form, what kind of responsibility is the application host provider really have in this whole world of regulatory and mobile devices and imaging? And those are, again, the questions that we like to ask. So just to wrap up a couple of use cases, some of the ways that we've either talked to customers about or we've speculated on how some mobile devices can be used in a hospital, not necessarily for a radiologist, but could be for any clinician. One could be on a textual report. Instead of putting the key images on the report, it could be a QR code on the report. Clinician then takes his mobile device, scans the report, and those images come up in context if the integration is done right. Another use case could just be the QR code at the patient bedside. Same system where the clinician is doing his rounds, walks in, scans the QR code, and the images appear on their mobile device. Another very similar type of application is a QR code that might be on the bottom here. You see a QR code on the wall. Pardon my image, it's obviously cut and paste in there. But what we have envisioned is that the clinicians walk in, they scan a QR code on the wall in the ER or the ICU, and then they get the list of patients that are in that ER. So that's another application for mobile devices and imaging. Another one could be study notification, and how third-party applications such as test messages now are part of that whole imaging chain, if you will. Walk into the neonatal ICU, no babies in this one right here in this picture, but then you could have on your text, you could have a text message sent, you could have image sent to your phone, and those are other types of use cases that we need to consider the regulatory implications for. And another one might be just about using proximity devices. Maybe you don't even need a QR code. A clinician or a radiologist walks up to a patient, and because of proximity devices that are in the hospital, those either GPS systems or near-field communication or Bluetooth then send a signal, and those images appear automatically. So those are other types of considerations that we have to have. So is that iPad now a medical device? Is the proximity sensor built into that unit a medical device? These are the questions that we all ask. So just to conclude, we all know that mobile access is important. It's going to become part of it every day, so we should expect it to be part of healthcare IT and imaging. There is many different situations sort of evolving right in front of us right now. Many radiologists and clinicians are asking us for these types of solutions and products. The mobile industry is moving at internet speed. We cannot move at internet speed. We have many special considerations that Dr. Hirschon has mentioned, but we do need regulatory speed. We need to be reactive as an industry, as the ACR and the FDA, to work together to solve these types of problems. Okay, any questions? Thank you.
I just have a quick comment. So I would say for getting my patient, the Bluetooth, yes. GPS, no, because we don't treat patients on the basis of the guy in room, whatever, because that's how you make a mistake. Unless your GPS was like the Marauder's map, which would show you who you're close to.
Could be.
It's fine.
We're entering a new world.
There you go. All right.